Morning everybody, I'm Gillian from Harpenden Injury Clinic and I'm an osteopath, and I wanted to talk to you today about what causes back pain and, more importantly, what can we do about it. Something I guess I get asked all the time in clinic. So, causes of back pain. Well, firstly, back pain is not all the same. Not everybody has the same back pain, so you do need it correctly diagnosing with an osteopath physio or even a scan. However, I want to talk about the common things, what most people are suffering from. So when we talk about back pain, people often say that the muscles feel tight, they feel like they're in spasm, or you might even explain it as a stiffness that you get. You wake up in the morning, the back feels stiff, or maybe towards the end of the day your back is stiff. So what's going on there from a physiological point of view? So if I take my model of the spine here, and I realise this looks probably a little bit like a dinosaur, but this is what we have in our bodies. What happens over time, the ageing process if you like, is that the discs, which are these little fat pads between the vertebrae, get thinner, they get squashed together, and that's just what happens over age, and that's exaggerated if you do a lot of sitting, a lot of inactivity, because the body will squash the disc. Now these are our sort of main shock absorbers in our spine, and as these get a little bit thinner as we get older, then the joints at the back of the spine here are getting closer together, so they are moving, they're going to be stiffer, there's not going to be there's going to be less movement, should I say, in the vertebrae itself, in the spine itself. So then what happens then, and this is a very slow process, is the muscles will start to get more involved. The muscles will overwork. So because the whole complex, the disc and the joint, is not moving as well, the muscles will then get activated and they overfire, so they're doing more than they should, and it feels like a really strong muscle ache. And we've all had a back massage, and that feels wonderful to have your back loosened up and massaged. But when it's very, very stiff, that itself is not enough. We have to try and get to the root cause, and that is the joints. That is trying to get the joints moving. So what can you do about it? If you're waking up on a regular basis, you're feeling like your back's stiff, and you're worried about it going, the muscles feel very, very tight, then come and see us, and what we will do is we will mobilise the joints in the spine, so we'll get those joints moving better. So any that's sort of locked up, we'll mobilise those, free those up. We might even do something called traction, which is decompressing the disc, so it's like a strong stretch for the spine, giving everything a little bit more room to move. And then we'll also follow that with some exercises, which will be really important that you'll do on a regular basis in order to keep that spine mobile. So if you're feeling like your joints are stiff or your muscles are firing and feel achy, then come and see us. It's at Harpenden Injury Clinic, and telephone numbers Harpenden 01582 764 361, and come and get your back sorted out. Okay, hope you found that useful. Thank you, bye.